Every year, we create even more life-saving medical advancements. These are just some of the medical procedures changing lives. Andy Sandner's face transplant. After a failed suicide attempt that left Andy's face disfigured in 2006, it took 56 hours and 60 staff members. With the use of videos, photos, and 3D imaging, they managed to take the face of a donor and successfully go through the tedious task of transplanting and connecting the damaged nerves in his face. The iWalk 2.0. This carefully engineered, multiple award-winning medical mobility device was invented to ease the pain and inconvenience of your conventional crutches. If you've ever had to use crutches, you can immediately see what these have to offer. The iWalk transfers the strain from your wrists and underarms to your legs, perfect for non-weight-bearing lower leg injuries. Naked prosthetics. Manufactured specifically for partial hand amputees, these futuristic fingers are custom developed for people who've lost their natural pointers. They were designed to support the rehabilitation process after prosthetic fitting, and they help amputees perform most tasks by mimicking actual finger motions. LASIK eye surgery. Laser-assisted in situ keratomileusis, or LASIK, was developed as a potential alternative to glasses or contact lenses. For this procedure, the eye is numbed, a flap is cut in the cornea, and a special type of cutting laser is used to change the shape of the cornea to improve vision by allowing the eyes to refract light properly. The Da Vinci surgical system. Robotic surgery has advanced astronomically over the decades. Founded in 1995, the Da Vinci surgical system allows for the performance of medical procedures without the use of traditional handheld instruments. Every new model comes with the latest technological upgrades, like 3D imaging, allowing a surgeon to commence an operation using a nearby console. They control high-precision instruments with a far greater range of motion than the human hand. Bronchial thermoplasty. This relatively recent procedure was devised to help people with severe asthma. Doctors insert a thin, flexible tube through the patient's nose or mouth and into the lungs. The tube then uses heat to shrink smooth muscle in the lungs. This keeps the muscles from tightening and causing an asthma attack. XStat. This modest little invention actually has the capability to plug a gunshot wound in just 20 seconds. The device injects small, rapidly expanding cellulose sponges into the wound cavity using a syringe-like delivery system. Upon contact with blood, the sponges expand, filling the wound, preventing excess bleeding. They can then be easily removed for further treatment. Rotationplasty. Probably the strangest looking procedure on this list, this procedure has a surgeon removing an affected portion of bone along with the knee joint. The lower portion of the leg is then rotated 180 degrees and attached to the upper portion of the leg, essentially making your foot your new knee, after which the patient is fitted for a prosthesis. Bridge-enhanced ACL repair. An ACL tear can be a devastating sports injury for most athletes. This surgery was devised to fix this all-too-common affliction. The procedure involves the use of a special protein-enriched sponge placed between the patient's torn ligaments and injected with their blood to encourage the torn ends to reconnect and heal. PSMA-targeted therapy in prostate cancer. Prostate cancer has plagued men for decades now. In fact, it's the most commonly diagnosed cancer among men in the US. PSMA PET scans use a radioactive tracer to visualize the location of prostate cancer cells. This increased accuracy means recurrent prostate cancer can be treated much more effectively. Brain-computer interface implants. Typically used for augmenting or repairing human cognitive or sensory motor functions, these brain implants helped Ian Burkhart, who lost all movement below his shoulders, to once again grasp, swipe a credit card, and even play Guitar Hero. Through advances in electrical stimulation technology, a microelectrode array reads his brain signals and electronically stimulates his muscles.